Over the past 20 years, Assistant Professor Dr. Carey Doberstein has been researching homelessness in Canada. He shared with us what the state of homelessness is in our country.
Around 230,000 Canadians, individual Canadians, every year will experience homelessness. On a given night, 35,000 will. So we're talking about big numbers of homelessness in Canada. And historically, homelessness has been largely a problem among single men. But what we see in recent decades is the emergence of what some people call new homelessness. So women, children, youth, families in the shelter system, even seniors and veterans in the shelter system. What we know is that over the past 20 years, homelessness is not a historical accident. It's the result of tragic decisions over a period of time by multiple levels of government. Of course, there's a personal dimension to any person's individual homelessness experience, and it has unique drivers. But we can point to significant cuts in the welfare state going back to the mid-1990s in affordable housing investments, social assistance, mental health services, and this has really resulted in an explosion of this new homelessness. What I found in my research actually stems from Jack Layton. Jack Layton, prior to becoming a federal NDP leader, was a Toronto City Councillor, and whose main reason for going into politics was around the issue of homelessness. And he actually wrote a book 15 years ago and argued that to end homelessness in Canada, what we need to do is harness the energy, the ideas, and the expertise of civil society actors. So people who work in the homelessness sector, mental health professionals, people who work in affordable housing, outreach workers, harness their ideas and energy to effectively devise more appropriate public policy. So he made this sort of sweeping claim that that's what we need to do to end homelessness, but unfortunately didn't provide much actual systematic evidence in his book. So I was curious, is this true? And that's what my book is about.